Total ankle replacements are a procedure done for degenerative arthritis of the ankle. So degenerative arthritis is the erosion of cartilage between these two bones. Pain comes about because that cartilage should feel nice and glistening. It should be like a cue ball. It should be nice and smooth without friction. Arthritis is when three things happen. The cartilage, that bushing between the two bones, becomes thinner. It develops spur formation in the front of the ankle joint, so you have painful, limited motion. Sometimes it could be a systemic disorder like rheumatoid arthritis, or you can have primary osteoarthritis, which is routine wear and tear of the joint. When the conservative things fail, you're faced with surgical intervention. And in the past, the procedure of choice was an ankle arthrodesis. And arthro means joint, desis means to fuse together. So we would fuse the tibia to the talus, and it would get rid of the ankle pain. So as the anatomy was better understood, the implants were better understood, the techniques were better understood, there's been a reemergence of total ankle replacements to the point where we're really replacing ankle arthrodesis or fusions. So what is a total ankle replacement? Similar to a knee or a hip, a replacement is largely a resurfacing of a joint. So you have your tibia, you have your talus, and you have the cartilage in between. It starts grinding and grinding and grinding and grinding, and it becomes painful. So when you resurface it, similar to a hip or a knee, it gets rid of the pain, but differently from an arthrodesis, you maintain motion in the joint. One of the causes of pain in an arthritic ankle is this. So if you notice, the back part of the ankle joint has some space, but as you get towards the front of the ankle joint, one, there's less space, meaning that that bushing or cartilage between these two bones is eroded, but also you see this bony prominence here that's called an osteophyte. An osteophyte is a bone spur, and here's another osteophyte. So you can imagine when this person tries to walk up and down a stair, anything where his foot has to come up, there's a mechanical impingement and blocking there. So what we do surgically is this. So this is his talus, where you remove the top part of this bone, the dome part of the talus, the weight-bearing bone, and the bottom of the shin bone, which is here, is where this spacer is. So this space between these two bones is the new cartilage, essentially. So here's the tibia. This piece, the gray piece, is the metal. This is the plastic, and this is the metal. So now you have a joint that glides and moves similar to your native ankle. The biggest advantage of a total ankle replacement is the elimination of pain and the restoration of motion. There are some instances where the total ankle replacement is contraindicated. So for example, if there's significant deformity, you cannot do a total ankle replacement, or it's not recommended. If the patient wants to get back to high intense activities such as tennis and basketball, a total ankle replacement is not a great option. If the quality of the bone is not good, a total ankle replacement is not a viable option. So it's definitely an emerging technology that's getting better and better with time. It's not for everyone, but it's significantly better than it once was. So the candidate for an ankle replacement is someone who has degenerative arthritis of the ankle that failed conservative treatment, that would like to remain with a mobile ankle, who also accepts some of the limitations that come with a total ankle replacement.